Hello class, my name is Emily Parsons, and for this week's discussion post, I will be discussing evidence-based practice of framework of the Stetler model of research utilization to facilitate evidence-based practice. This model is useful for assessing how research findings can impact nursing care when implemented. According to McMaster University, no date, the 5 phases of this model are preparation, validation, decision-making, application, and evaluation. In the first phase of preparation, the researcher will identify the need for the research topic. The second phase of validation is when the researcher will decide the quality and reliability of evidence in relation to the research. In the third phase of the decision-making process, the researcher summarizes sources of evidence and decides if it's acceptable to apply to the nursing practice or not. The fourth phase of application is when the researcher decides on how to implement these practices in a way that will improve both nursing practice and patient outcomes. The fifth and final phase of evaluation is when the researcher identifies the outcomes of the research and determines if the goal was achieved or if changes need to be made to better improve the patient outcomes. Galveston College 2024 argues that this model promotes use of best evidence as an ongoing practice, helps lessen errors in critical decision-making, and encourages critical thinking about the integration of research findings. This research model could be useful in my clinical practice in several ways. An example being that my unit has a high hospital-acquired pressure ulcer incident, and I could use this to apply the best evidence-based care to improve our nursing practice and to improve patient outcomes. First, the purpose of this project is to decrease pressure ulcers on the trauma unit by exploring evidence-based alternatives. Next, I would conduct a literature review on various techniques on prevention of hospital-acquired pressure ulcers while assessing the validity of each research article that I consider using. After reviewing the literature, I would choose the most appropriate strategy for this project, whether it be frequent repositioning, the use of citadel beds, the use of pressure relieving mattresses and cushion, or maybe even friction reduction techniques. After I have chosen an intervention, I would develop a clear plan to implement the project and provide education to both staff members and patients, and then I would also make any changes in the documentation that reflect the new project protocol. Finally, I would collect data on the implemented project and assess whether the new intervention influenced hospital-acquired pressure ulcers among my unit or not. I would also make any necessary changes to improve patient outcomes and to further decrease pressure ulcers. Thank you for listening to my discussion on the Stetler model of research utilization to facilitate evidence-based practice, and have a great day.